a paediatric gastroenterologist. Most of my talks sort of focused around children, but there's implications for adults as well, of course. I'm going to talk a little bit about celiac disease and fill in some gaps from some of the previous talks. I'm going to present some little scenarios about some children that were diagnosed with celiac disease, some of the key things that are a little bit different in children compared to adults, and think a little bit about what happens beyond diagnosis, so filling in some of the things that Alistair's mentioned until we get to our 100th birthday. So this is something that's been around for a long time. This guy in the Mediterranean many centuries ago described something that's probably celiac disease, and the name here from the Greek is the word that is the derivation of celiac disease, or celiac. This chap in 1888, so many years ago, described celiac disease and started to get the connections between cereals and what was happening. But it wasn't until this chap in the middle of last century, he really started to put together wheat and cereals and causing symptoms. And part of that was in the context of post-World War II in Europe. Some of these countries were having bread drops, so people were really well, and then they got exposure to bread and their symptoms came back, and it was sort of that cycle, and they started to get those connections. But celiac disease at that time and prior often had fatal implications, so there wasn't a way to manage it. Steroids were used in some cases, so anti-inflammatory treatments. And then the gluten-free diet evolved in the middle of last century, and things have continued to evolve over the decades since, and there's continued ongoing changes even as we speak today. So gluten, so it's the storage parts of the cereals that are the key factors. There's lots of other components within cereals as well that can also cause symptoms. So Alistair mentioned allergies, so there's other proteins that might contribute to that. There's sugars and so on as well, but it's the storage protein that's really good for making bread and so on that is the key factor in terms of celiac disease. So there's some of those culprits. Wheat, barley and rye are the predominant cereals that we worry about. Some of these other cereals like corn and rice are very distant relatives and don't have those same concerns. Oat is the next closely related to wheat, barley and rye. One of the problems with oats, essentially anywhere in the world, is that it can be contaminated. So this is a field of oats, but we've got these little wheat guys growing in between it. And there can be contamination at a whole lot of other levels as well, but that's just one illustration of that. So what is celiac disease? So fancy long term, it's the immune system triggered by the cereals in somebody who's genetically at risk that leads to the damage. This is a slightly fancier cartoon to illustrate this, but I'll just show with some of the key things. These little yellow guys at the top are the parts of the cereal that we can't break down. So we can break them down into certain chunks, but we can't break them down beyond that. And if in the right setting they get through the barrier in the gut, then they start to get digested and they can be taken up by the immune cells, and it's the immune cells that come along and cause the damage in the gut. And other immune cells over this side make the antibodies that we can measure in the bloodstream as well. So the key things in terms of somebody having celiac disease is having the genes, having exposure to those proteins. So a little baby who's just being breastfed can't get celiac disease. They're not having it in their own diet and having that exposure. Genes are important, and these are just two illustrations of those genes. Probably half to 2/3 of Christchurch have one or other of these genes are at risk and make people at risk. But checking these genes doesn't say whether you have celiac disease, it's just a risk factor. And they're risk factors for other things as well. So this is what things look like at the coalface, so to speak. So this is the normal surface of the bowel. So when I'm looking in a child, this is what I'll see. In somebody with celiac disease triggered by gluten, this is what it looks like. And one of those characteristic things is that this fold here, instead of being nice and smooth, is ruffled a little bit like a curtain. And under the microscope, there's a whole lot of changes that we can see as well. And as people with celiac disease will recognise, a gluten-free diet is the only treatment we have at the moment. And the idea is that this comes back to the normal appearance and the normal function of the gut. And bread can be one of the key triggers or key things containing gluten, huh? So celiac disease is a bit like this little guy here. He's hiding in the bushes. He's a chameleon. Celiac disease can be a bit of a chameleon because it can hide in lots of different ways. And before we talk about some of those, I'm just going to illustrate this point as well. So there might be some art historians amongst us and can remind me which artist, I keep forgetting which artist did this Madonna and Child. But this was, I think, in the 13th century. And baby Jesus is illustrated here. 100 years later, a different artist, Madonna and Child, and the baby's in the correct proportions. Children, infants, toddlers, they're not just little adults, they differ in a whole lot of different ways, including in terms of aspects of celiac disease. Some of the key ways that children can have, or symptoms that children can have, are listed here. They include the gut not working well, so malabsorption, not absorbing the goodies, so not growing. It might be just not getting taller in terms of short stature. It might be not getting into puberty at the right time. Or it might be one or other micronutrients like iron, so getting iron deficient. And iron is absorbed in the part of the gut where celiac disease has the most damage, typically. So it's one of the micronutrients that can often go astray. Several times a year, I'll get a referral from an oral medicine specialist about a baby or not a baby, but a toddler or a child who has mouth ulcers. No other problems, just the mouth ulcers, and they turn out to have celiac disease. But also at the bottom here, many children won't have any symptoms and they're picked up for different reasons. If we look at some of the range of things in adults, it might include osteopenia or osteoporosis. It might include some of the things that Alistair mentioned earlier, like brain fog or neurological problems, or indeed infertility or recurrent miscarriage, so things that aren't so relevant in children, but these guys are more relevant in adults. But also at the bottom here, many adults will have celiac disease and not have symptoms as well. And they may go on through life and trying to reach that 100th birthday, but the celiac disease will be there in the background, interfering with their body in different ways, but not in terms of recognised symptoms. Okay, here's some little scenarios. So this little girl, she had lots of malabsorption, so her gut wasn't working right at all. So she'd had several months of symptoms, diarrhea, big pot belly, grumpy, irritable, not growing. And on examination, she looked skinny and scrawny. She was grumpy as hell. Belly was distended. Lots of changes that go along with celiac disease in terms of her blood tests. And she indeed had very severe changes in the surface of her gut. 4-year-old boy, a bit of belly pain for 6 months or so, off and on, no other particular problems. His celiac tests were up just a little bit, and he had changes on his biopsy as well to make the diagnosis of celiac disease. 13-year-old girl, she was diagnosed a couple of years ago, twins, identical twins. And the only reason that the family was concerned was that she wasn't getting taller and growing the same as her identical twin sister. And she indeed had very, very high levels of antibodies in the absence of any other symptoms. And she had iron deficiency and went on to have a diagnosis of celiac disease as well. How about Samuel? So 18 months of some belly pain, no other particular problems, growing well, a little bit of change on feeling his belly, but nothing particular concerning. And we'll talk more about Samuel in a moment because I'll use him to illustrate some further points. But just to emphasise this really key thing, wide range of different ways that celiac disease can present. And if of you guys in the audience, if we lined you up, you'd probably all have a different story to tell about how celiac disease presented or manifested for you or your loved ones. Just illustrating this in a slightly different way, this is 260 odd children, some preschoolers, half of them had diarrhea, lots of weight loss. Most of the older children had belly pain, but these weren't the only symptoms that these children had, and so there's some similarities across age ranges, but it's not absolute. Okay, so Samuel had some blood tests, and he showed changes in his antibody levels. He had a low vitamin D and low iron levels, and he went on to have a biopsy, and just like those pictures before, these are his pictures. So he had the scalloping of some folds in his duodenum and the small bowel that suggested celiac disease, and he had a biopsy that showed damage to his gut, consistent with celiac disease. So he's joined the celiac club, he's got celiac disease. What next? He needs to get onto a gluten-free diet, and that's very easy to say, isn't it? But maybe harder to do. He needs to meet with a dietitian. He needs to learn about celiac disease, as do his parents. And joining in with Celiac New Zealand, and some of you may be aware that there's children's support groups in Canterbury and elsewhere where children can get together as well. That can be very important. Alistair alluded to the special authority for some gluten-free foods. There's now only 4 on that list, but that might still be helpful for some people. Checking out the micronutrients, as mentioned, iron is the most important, but those are some of the others as well, and fixing them. And screening the rest of the immediate family. So within a family, other first-degree family members will have about a 10% risk, compared to about 1.5% risk in the community, something like that. So his mother, his father, and both his siblings had blood tests. His mother was fine. His father's got elevated level, and he's had some variable stools that he was putting up with. Brother was fine, and the sister has positive antibody levels, but she's completely well otherwise. So some further assessments for a couple of those guys in the family. Lots of things can link in with celiac disease, and this is just a list of some of the key things. But the guy at the bottom, family history, is one of the most important. Just to illustrate that a little bit more, this was 300 children from here in Christchurch. About more than a third of those children had a family history, so someone else in the family that had already had celiac disease. 9% had diabetes, 5% had Down syndrome, trisomy 21, and in both these groups, there's active screening of children. So if somebody's diagnosed with diabetes tomorrow, the endocrine doctors will check for celiac disease right at the beginning, and then every 12 months. But even in this group, 40 of these kids, no symptoms, but they were diagnosed with celiac disease through that active screening. And I don't recommend screening beyond the immediate family, but I do suggest to parents that they talk to their siblings, so the cousins of the child, and mention, because the risk is probably greater in those second-degree family members, but not as much as 10%. Okay, so is it gluten-free or not? So Samuel got better pretty quickly after starting his gluten-free diet. Within 2 weeks, his pain had gone. He was feeling better, more energy, more activity. He continued to gain weight and height appropriately. He was doing well with sticking to a gluten-free diet. He was being careful inside the home and outside the home. And at 6 months, his antibody levels were completely normal. And his iron was good and his blood count was good. So he was doing great. And his mother asked us, are there any side effects to be worried about? And will he grow okay? Will he get into puberty and will he grow? And essentially the answer to both of these questions is yes. In terms of growth in particular, most children do fine and grow appropriately, catch up with any interference of their growth parameters after getting on a gluten-free diet. But some overshoot a little bit in terms of gaining a little bit too much weight. Looking at this in another illustration, so overall in these children from the UK, their growth was great. 13% were overweight over time after starting the gluten-free diet. But some of those children with obesity or who were overweight at the beginning had normalisation of their growth with time. So it can go both ways. And I'll skip that, it just says the same thing. His mother also asked, will he get everything he needs from the gluten-free diet? And there's various illustrations of this as well. So this is some Scandinavian children, and in these children, they were getting a little bit too much sugar and fatty acids in their diet and not getting quite enough fibre, vitamin D, magnesium, selenium. And Sophie talked earlier about fibre, which is one really important thing for all of us in terms of our diet, and optimising that's really important. Another group of children had more simple sugars, fat, proteins and energy on the gluten-free diet compared to other people without celiac disease who weren't on a gluten-free diet. So yes, he may not, actually the answer is no, isn't it? No, he may not get all the goodies that he needs, but it's really important to meet with a dietitian, and that may need to be more than once in terms of emphasising and building on those things. Okay, so Hansel and Gretel, is it really gluten-free or not? So what are we doing for Samuel? Monitoring plan. A little bit like what Alistair mentioned, it's really important to have regular ongoing review. And over time, there's various studies that have looked that could be a dietitian, it could be a GP, it could be a gastroenterologist. Who does it probably doesn't matter. The fact that it is done is the really important thing. And that's checking for adherence. Is Samuel continuing to take his gluten-free diet and stick to things well? Is he growing well? Is he having any gut problems? Is he having any other problems that could be tied in with celiac disease? And what's happening to his regular blood tests? And if there's concerns from the GP review, then it's important to get reassessed with the dietitian, for example, or reassessed by a gastroenterologist. What actually happens over time, and there's some people around the world that have looked at this. One way of considering this is that, yes, we can use the TTG, the blood test, the antibody test, but it's not always helpful, and there's some group in Europe that developed this test, which is looking in the stool for components of gluten. And if you have a positive peptide test, then that's an indication that you've been having gluten in the last while. We can measure this in the blood as well. This isn't available at Awanui Lab or in a lab near you, and it's more of a research level, but it's becoming accepted as a potential tool to monitor how people are going. Mosheen and his colleagues in Canada looked at a group of children. 95% of them were doing well with adherence to a gluten-free diet. More than half of them had had reactions due to accidental exposure. Up to 20% had disruptions to their normal life, to what they expected. Almost 1 in every 4 were angry about their celiac disease or having to have a gluten-free diet. 15% avoided travelling. Most of them took gluten-free foods with them when they left the house to help manage and be prepared for those things outside the home. So that diagnosis might be life-changing, but there's lots of ongoing things that are important for children as well beyond the time of diagnosis. Skip that. Lots of adolescents push the boundaries and like to spend more time out of the home and with their peers, and this can be a big time when adherence might be tested or questioned as well. And there's various ways that might help with that, such as maintaining that awareness, maintaining that regular review in an adolescent, various electronic tools to look for or think about, could this be gluten-free or not, and awareness and knowledge being paramount as well. So often children that are diagnosed with 3 or 4 years of age who've grown up with celiac disease and being on a gluten-free diet, it's just part of their life. But if you're 13 and 14 and your friends want to go to McDonald's or wherever, how do you fit that in with fitting in with your social group when it's a new thing? People have looked at how celiac disease impacts upon children's life, and there's a thing called quality of life, and this is one of the tools that can be used to measure that. And generally, in studies that have used this tool, people that are less adherent tend to have lower quality of life, as well as having more family problems and more physical problems, more symptoms. So those things tie in together in terms of how well you're doing with the gluten-free diet and how well the celiac disease impacts upon the rest of life. Are we doing the best that we can? What ways can we do it better? And Alistair sort of asked this question as well, and there's certainly ways that can be improved and should be improved. Knowledge is one really important thing, and there's lots of studies looking at how people understand and know about their health condition, whether it be chronic chest problems or diabetes or haemophilia or whatever. Increased knowledge impacts upon these things in terms of quality of life, the health outcomes of that person, and so on. And Sophie, who spoke earlier, in her PhD, has developed this tool called the CD-Know, Celiac Disease Knowledge Tool. And this has been evaluated very carefully and well validated, and it links in with adherence in terms of the more you know, the better adherent you are to your gluten-free diet. There's 15 items in this. I'm going to mention 3 and I'm not going to give you the answers. You can work out this yourself. These ones aren't particularly tricky. So if a food states that it is wheat-free, is it always gluten-free? Yes or no? If a food label says starch, does it always contain gluten? And what is gluten? A protein, a fat, a carbohydrate, or something else beyond that? Those are just 3 of those 15 items, but it's a way to assess how well people understand and know about their celiac disease and their gluten-free diet. And clearly food is important, and in children some of these food-related activities are challenges for them and for their families. How do we prepare little Jimmy when he's going to a school camp? What do we need to do? A sleepover, a birthday party. I realised afterwards I put home economics, but I think it's called food tech now, isn't it? But anyway, all of these things can be potentially challenging, and one of the really key things is planning ahead and preparing, and different families might do this in different ways, but having a plan in advance is really important. And I've mentioned school camps. Residential camps have been increasingly looked at and considered for children with a whole lot of different chronic health problems. Inflammatory bowel disease, diabetes, haemophilia, kidney camp, and so on. And these have lots of different benefits, but some of them include improving knowledge, improving adherence to their diabetes or their blood testing regimens, as well as improved confidence and making friendships, realising you're not the only one in the world with this particular condition. And celiac camps have emerged in the more recent times, and this is one in Europe, so some Austrian children were sent off to a camp in Switzerland, and in the second one, it's children in the US that went off to camp, both of these for a week, and they showed a number of really positive benefits in terms of attending this camp together. And just to emphasise in terms of the really important role of Coeliac New Zealand within many of the things I've talked about, education, knowledge, resources, advocacy, and so on. To summarise, celiac disease is at least 1 in 100, probably way more than that, a whole range of different presentations, and kids have different aspects than adults do. At the moment, it's the gluten-free diet and strict adherence to that, knowledge, support, monitoring, really important things beyond diagnosis. And I'll leave you with this, so the final little thing, and thank you for your attention.